Now, we have a few more amendments, but I'd like to ask unanimous consent that we limit the debate to 5 minutes for the amendment, 5 minutes against the amendment, although not all the amendments are going to be opposed. What do we have? Mr. Doyle.
Thank you, Mr. Chairman.
You have an amendment at the desk.
Yes, I have amendments at the desk. Is Doyle number 1, McNerney number 2, and Engel 4-003. Mr. Chairman, I'd like to ask unanimous consent that these amendments be considered en bloc.
Without objection, that'll be
reserving the right.
Reserving the right to
Reserving
object.
the right. I just want to make sure that these are the amendments that we've agreed to that are in bloc. Is that correct?
Yeah, I think so.
We think so.
We think they are, but we'll just wait and pass them on.
If they're not, we'll.
Could we have the titles of the amendments in bloc?
Yes, let's have the clerk report the titles of the amendment before we put the unanimous consent request to consider them in bloc.
A Doyle amendment to subtitle Grants for National Training.
We're okay on that one.
Without objection, that one will be considered as read.
Amendment by Mr. McNerney and Ms. DeGette of Colorado at the end of Section 2401.
We're okay on that one.
Without objection, that'll be considered as read.
And then an amendment in the nature of, to the amendment in the nature of substitute by Mr. Engel of New York.
We're okay on that one.
That's
page
it.
9.
Without objection, that amendment will be considered as read. Let me put the unanimous consent that without objection, these 3 amendments be considered as bloc, in bloc. Without objection, that'll be the order. Mr. Doyle?
Thank you, Mr. Chairman. Mr. Chairman, I also request unanimous consent to add my colleague, Mr. Engel, as a co-sponsor of Doyle number 1 also.
Without objection, that'll be the order.
Mr. Chairman, I offer this amendment with my friend and colleague, Elliot Engel, who has worked with me on this provision in our bill, the Autism Treatment Acceleration Act, which was also introduced with my co-chairman of the Coalition on Autism Research and Education, Chris Smith from New Jersey. We introduced this language because there's a critical shortage of appropriately trained personnel across numerous important disciplines who can assess, diagnose, treat, and support children and adults with autism spectrum disorders and related developmental disabilities and their families. Mr. Chairman, I'm glad to know that you've pledged to work with me on my top priority, making sure that this bill ends autism insurance discrimination. But because this division of the bill addresses 21st century healthcare workforce issues, I want to make sure that we're translating current and future research results into effective practices. We need to support children and adults with autism spectrum disorders and related developmental disabilities with early intervention and preschool programs, child care, community schools, health providers, employment sites, community living, and first responders. This amendment creates a national training initiative on autism and a technical assistance center to develop and expand interdisciplinary training and continuing education on autism spectrum disorders. I hope that everyone will support this amendment, and I'd like to yield to Mr. Engel.
Well, I thank my colleague for yielding for me. I've had the privilege of working with Mr. Doyle, who's co-chair of the Congressional Autism Caucus on comprehensive autism legislation for several years. And we know, of course, with the growing number of people diagnosed with autism, many of whom are aging out of the school system, it's imperative.
Mr. Chairman, if they keep talking, we're going to withdraw our support for these amendments. We didn't let Mr. Gingrey speak on his, so we shouldn't have to hear ad infinitum the great things about these, although they are great amendments, which is why we're supporting them.
All right, I'll put it in the record then, as long as Mr. Barton supports the bill.
I support it in its current form as long as we don't talk it to death.
Are we ready for the Are we ready for the vote? All those in favor of the amendments in block say aye.
Aye.
Aye. Opposed, no. The ayes have it, and the amendments are agreed to.